Correct. So thank you so much for having me. So my name is Hagay Levy. I'm the founder and CEO of Iluria. Iluria is a digital health company focusing on remote patient monitoring for mental and behavioral health disorders. We will focus on ADHD, anxiety, and depression, and the initial focus is ADHD. And for those of you who are maybe not familiar with it, ADHD, attention deficit hyperactive disorder, is considered to be a chronic disorder with short-term implications of inattention, hyperactivity, and impulsivity, and some pretty severe long-term implications if not properly treated. Please meet Elad. Elad is my youngest out of four kids. He was diagnosed with ADHD at a very, very young age, and it was almost impossible for us to manage his treatment as we could never assess whether the medical treatment was effective or not. And Elad and my other kids are not alone. Roughly speaking, 1 in 10 kids and 1 in 20 adults are diagnosed with ADHD. And the treatment processes are almost completely trial and error based. And the reason for that actually starts after the initial diagnosis. The initial diagnosis is also kind of trial and error based, but afterwards starts a never-ending process of calibrating the medical treatment to get rid of the changes in our physiology. And this never-ending stage is completely trial and error based using the manual subjective questionnaires, same as it was 20, 30, 40 years ago, with not only very poor clinical implications, but enormous cost, which results from this volatile, manual, and super labor-intensive process. And this is the gap that we're trying to solve. We are developing a solution which will basically streamline the entire process and will deliver continuous and objective monitoring. And the basic idea is to analyze changes in physiological markers. Retrieves physiological markers from basically any smart commercial device. We will start off with Apple Watch 7, but basically speaking, we are completely agnostic. And then we trained algorithms to automatically analyze changes in these markers and deliver analysis reports to the different stakeholders while completely focusing on the effectiveness of the medical treatment. We completed 2 clinical trials, one in Israel with the largest HMO, an initial stage of a clinical trial in the States with the Cincinnati Children's. And a month ago, we started another scale-up clinical trial in Italy with the second largest child development center. But just to close the loop with regards to the product or the service, let me present you with the old versus the new. So as I mentioned, the current method is completely manual and super expensive due to mostly loss of labor. Whereas in the new approach, we can deliver continuous and objective monitoring in many different layers, starting from more of a pinpoint analysis. We're basically creating proxy personal intraday PK curves according to the personal reaction to the medication. And then more of an aggregated data, such as titration analysis, or in this specific case of my young child, what happened before you titrated and it was missed out. Ongoing patterns, and basically speaking, completely eliminating the trial and error which is associated with the process. A few words about the business. We are targeting the large institutional players with a combined value proposition of not only better caregiving, but also immense cost reduction, again, mostly labor-wise. The parents are a very valid stakeholder as well, and actually as the lowest hanging fruit, we will approach them in mid-2022 with the initial version of the product by leveraging the reach of some platforms. The pharma players are a super crucial stakeholder. The adherence in ADHD is awful. But again, we don't have too much time to elaborate on them and on other segments. The total addressable market is quite large, taking into consideration the overall prevalence and the specific segments we are targeting, the estimated cost reduction, and the price point. To sum up the presentation, I will describe our current status. We've done a super long kickoff phase with lots of validations. I mentioned also the 2 formal clinical trials that we completed. We got dilutive and non-dilutive funding, and we also secured the IP for ADHD, anxiety, and depression as the next milestone. We are almost at the end of the initial round that you see here. And the overall goal, as I mentioned, is to deliver a commercial level solution by mid-2022, not only to scale up, to facilitate the clinical scale-ups, but also to touch base with the markets, again, initially with the parents. In the internal team, we have many years of experience, mostly in medium-sized companies that some of them afterwards exited. We are getting a lot of support both from the internal team, which is mostly consists of physicians, and obviously from the other different worldwide partners who are working with. As I mentioned, we almost completed the pre-seed round. We have a couple of slots open. And again, the overall goal is to be in production by mid-2022. And we started working on the next round, which will enable us, basically speaking, B2B commercialization, meaning post-regulatory compliance and post-reimbursement mechanisms. So thank you so much for having me, and I will be happy to address any question that you may have.
Yeah, I would like now to invite Svetlana to ask her question.
Thank you. Yeah, as in the chat, I'm just curious, what kind of parameters are you monitoring in the treatment optimization?
Yeah, it's a great question. So actually, the more the merrier, and not only in the theoretical sense of machine learning, likes many parameters, but when you're looking at it clinically, there are many physiological markers who are already clinically associated with ADHD. In the clinical trials that we completed, we measured movement, meaning accelerometer-based movement, angular movement, which is a completely different marker in ADHD. Various heart rate analysis, meaning heart rate, HRV, IBI. With the wearable that we use, we also had galvanic skin response and skin temperature. While we will swap to Apple Watch 7, obviously we will have to reduce the GSR, but we will have a couple of additional markers, such as respiratory rate and blood oxygen saturation.
I'm wondering about the global expansion. You've done a lot of clinical trials already around the world. How is that going? And is it complicated to work in so many markets? And what's your ideal place to really grow this? There's a lot of difference in regulation and recognition and treatment of ADHD. Where is it working best, and what could Canada provide?
So I would assume that the initial market to start with will obviously be the US market, not only in the sense of the size and the regulatory environment, meaning hopefully our ability to be classified as a decision support solution, but also in the sense that the prevalence of medications is quite large in the US, way larger than in Europe. Like you have many different brands with many different dosages. Actually, it was, again, I'm saying it very cautiously, but it was pretty easy for us to start clinical trials. And actually, hopefully by the end of this year, we'll start 2 additional clinical trials in Hungary, actually, and in the Netherlands, because the response from the main stakeholders, which are the physicians, is very nice. So we're basically piggybacking on existing clinical trials, or they're simply getting internal grants, and then we're starting the clinical trial from scratch, but again, using their assistance. Now, with regards to the Canadian market, obviously, it's a super interesting market. I would think, I think that there are a lot of similarities to the structure of the market, looking at the Canadian market in Israel. I'm based in Israel. The entire company is currently based in Israel. And I think we should, while approaching the Canadian market, we would obviously, first of all, love to gain clinical traction on Canadian soil as well. And basically speaking, I think we need to better validate the go-to-market in the Canadian market. So again, we're looking for collaborations, partnerships. So